Hello everyone, good afternoon. My name is Karen Riley and I'm an occupational therapy assistant at Pembroke. The purpose of this discussion is to inform you of the assessment tools that we currently use at our facility for functional medication management to prepare our patients for a safe discharge home and to prevent prescription drug misuse. Upon discharge, it's imperative that our patients can demonstrate proficiency with each item listed on Reliance medication management checklist. We use a variety of tools to assess an individual's ability to safely self-medicate at home. I've included a packet with some of the tools that we use for assessments. As with any treatment, each patient is unique and may require modifications. Informal medication assessment begins with simple observation. It is important to observe each patient with their nurse when they're given their medications. Do they take all of their medications at once in a cup? Is their medication ground up in applesauce? Can the patient bring the pill to their mouth, or do they need verbal cues to slow down, take a sip of water? Also, is there an open dialogue with their nurse regarding the medications? Do they ask questions? Do they request a specific pill? These initial observations set the baseline for the patient's treatment plan. The first section of the packet I provided includes a worksheet we use to begin a more formal assessment of the patient's ability to perform functional medication management. The first worksheet focuses on the patient's ability to read, interpret, and comprehend prescription labels. On the worksheet, you'll see 3 standard-size prescription labels and a questionnaire to determine if our patients have the ability to look at a prescription label and correctly identify the medication name, the doctor's name, the pharmacy's phone number, the dosage amount, if there's a refill, if and when their prescription expires. All of these are criteria listed on Reliance Medication Management Checklist. As I stated earlier, each patient is unique and each assessment may need to be modified. We currently have a patient at our facility that states that he does all of his medication at home independently, and the way he does it is just by going to the pill boxes and grabbing his pills when he needs them. We gave him the standard size prescription label worksheet, and he wasn't able to correctly identify any of the information. He particularly had trouble with numbers, which can be extremely dangerous. To determine if this decline was due to vision or cognition, I gave him one of our enlarged prescription labels, which is also included in the packet. Fortunately for him, he was able to answer the questions correctly with the enlarged prescription labels. And now we're working on 2 different strategies. One is using a simple magnifying glass at home with the prescription bottles to continue on with the way that he was performing his medication management. The other is a color-coded system with the bottles color-coded with enlarged labels. But the second strategy, the success of the second strategy really depends on the patient's caregiver's family participation to demonstrate that these strategies are being implemented at home, that there's carryover. The next worksheet in that section covers safe medication storage at home, and it's really just to focus on if our patients are able to understand what is correct medication storage, what may be unsafe, and their overall responsibility with their medication. In the next section, you'll see a sample write-up of a daily prescription schedule. This is what we call our pill box activity. We provide the patient with a schedule, a 4-section pill box, and 11 pill bottles. Each bottle is labeled with one of the medications listed on the schedule, and each bottle also has a different type of child safety lid, all varying degrees of difficulty, and they have different sized beads inside of the pill bottles. The goal is to see if the patient can correctly fill in the pill box for the week. The activity demonstrates if the patient can correctly match the pill bottle with the medication listed, if they can open the different varying degrees of difficulty of the lids, if they have the manual dexterity for that, and if they have the manual dexterity to count out the correct pills and place them in the appropriate section of the pill box. Once a patient appears proficient with the basic skills required for safe and functional medication management, we focus on the patient's current list of medications. We talk to nursing and we print off a list from Point-Click Care, and then we have the patient list each of their medications. There is a section on the last page of Reliance Medication Management Checklist that we have them list all their medications on. We go through each medication with a patient to ensure that the patient is able to tell us what the medication's for, that they understand the dosage of the medication that they're currently getting. There is a handout in the last section of the packet. It's called Questions to Ask Your Doctor About the Medications. We often use this questionnaire for the patient's current medication list just to know that they have a good understanding of what they're taking and the effects that it might have on them. But this questionnaire is also good for the patient for any additional prescriptions prescribed to them after discharge. Again, each patient is different. Some patients may require assistance from caregivers to go home safely, to help perform their medication management. It is important to look at all options with your patients and the patient's caregivers. Lastly, in the packet, I have included pictograms. We do use them on occasion with some individuals who are better with pictures. I hope you found this presentation helpful. If you have any questions at all, please feel free to contact me at Pembroke, or you can ask Ed. He's very educated in our system as well. Thanks, and have a wonderful night.